Good morning and happy Sabbath once again. We're going to kind of talk about something that we talked about probably about 6 months ago when this all started. It's always good to review sometimes. There actually are no slides for this morning, unfortunately. But here we're going to talk about something you can actually get in a bottle. Wow, people love bottles. All right? And so we're going to talk about this. This is vitamin D3. Amen. All right. So normally we can make it. It comes from the sun. When the sun hits our skin, the cells in our skin actually convert it with the help of our kidneys into an active form that our body can use. So we can actually make this vitamin, or actually hormone. But however, just because of our society and the way we are, we probably don't make enough, even during summer. And the reasons are multiple. Number one, for myself, I work indoors during the summer, and I should be outside by the lake. But unfortunately, I'm inside, so I can't make vitamin D indoors. So I've actually tested myself, and to my surprise, I was actually fairly deficient. And so what is vitamin D once again? Once again, it's a fat-soluble vitamin. And it's very crucial for many bodily functions. Before, we used to think it was just good for your bones to help calcium absorption, which is true, but there's a plethora of other functions within the body that are very important, which vitamin D is actually crucial for. There is there's a lot of medical literature showing that vitamin D can play a role in the prevention and or treatment of certain illnesses, like certain rheumatologic disorders, multiple sclerosis, rheumatoid arthritis, stuff like that. The reason is because, once again, vitamin D has a role with the immune system. It doesn't necessarily support the immune system or boost the immune system per se, but it supports it. It gives it allows the body to turn on good hormones, which decrease inflammation, and so it suppresses that, and also can help increase certain hormones that are beneficial as well. So there's articles suggesting that it can be used in cancer prevention and treatment, not solely, once again. Chronic pain, depression, diabetes, interesting. Vitamin D deficiency is thought to play a role with vitamin D. So anyways, there are just multiple reasons to make sure that you are sufficient. And it's interesting, in this time of our history, we are always thinking about viral illnesses, especially COVID-19. And so it's interesting to note that there are a lot of studies going on looking at vitamin D as a viable supplement to take to either decrease your risk of contracting the viral illness and or helping your illness less detrimental or long-lasting. And so there's actually one study that was done that concluded earlier this fall that looked at about 12,000 or so people, and the conclusion was that those who were vitamin D deficient were more likely to have serious illness by about 50%, and also have serious complications from COVID-19 specifically by about that same ratio. And this isn't really all that new. There was a study in 2010 that looked at Japanese school-age children, and there was about 340 kids that were given, put in the study. Half were given vitamin D of about 12,000 units. The other half wasn't. They're given placebo. And guess what? The half that was given vitamin D, they were half as sick. The Finnish army, actually, there was a reference to what happened in Finland. They noticed that in the Finnish army, which is very way north of the equator, they noticed that those who were vitamin D deficient or didn't have enough vitamin D, guess what? And then those who were vitamin D sufficient, they actually had more duty days than the ones that were deficient. So there's definitely something plausible about this. All right. And so with vitamin D, you can't really get it from your food very easily. There's not a lot of good sources. If you want to get it from milk, you have to drink about, oh boy, a lot. there's only about 100 international units per glass. And so if you think about it, current recommendations from the USDA, they say that our recommended daily intake should be about 600, but that's actually too small. There's actually a lot of other proponents out there for higher levels, such as 1,200 to even 2,000 units a day. So if you're going to think about that, so if you get it from milk, that's about 20 glasses. That's pretty sickening, actually. And so that's not very good. It's better off, once again, to get it from the sun, but you have to have the proper exposure. And guess what? We're in winter. And so we're actually in solar winter. Yes, it is fall, but it's solar winter now. And so we can't actually make vitamin D properly until about mid to end of February. So think about that for a moment. So the only really good source to get that is from a supplement. And once again, here I have a vitamin D3 liquid. Liquid is actually more bioavailable or easier for your body to take in than a gel cap, which is better than a tablet. So if you can find a liquid form, that's much better. And for doses, basically, for up to 2,000 to 4,000 have been proven to be safe and effective. And so even for kids, they can take in at least 1,200 easy without any significant issues. And so, some people do take mega doses like once a week, but some studies have suggested that you should take in vitamin D on a regular daily basis in smaller doses like 1,000 to 2,000 units versus taking a whopping dose of 50,000 units at the end of the week or a week. So anyways, once again, this is not a cure for anything. But once again, there is science behind this, and it's reasonable to take something that we so desperately need in our bodies, which is so crucial to bodily function, which can help prevent infections or lessen the symptoms of an infection. And once again, other studies from even before we tested for vitamin D looked at tuberculosis. You know what they did with tuberculosis patients? And they didn't know it, but they were using vitamin D. They set them out in the sun, and guess what? They got better. So there is something to it. It's not hocus pocus. And just to recall the verse that was used many months ago, it's from Jeremiah 33:3 and 6, part B. It says, "Call unto me, and I will answer you, and show you great and mighty things which you do not know. I will heal them and reveal them to you, reveal them in the abundance of peace and truth." And it goes on to say, "Then the body of Israel," parentheses, "shall be to me a name of joy, praise, and honor before all the nations, who shall hear all the good that I do for them. They shall fear and tremble for all the goodness and all the prosperity that I provide." And so once again, we want to be that beacon of light in health in our communities, to our friends, and so that we can share the gospel, the good news of Jesus Christ with them. Amen. And this is the whole point of the season, and really it should be the whole point of being in good health, so that that they can ask and we can give them, and they shall receive. And this is stuff that's given to us by God. And so happy Sabbath, and amen.